A couple of things that are arising from the conversation, not necessarily the original questions I was going to ask. And this is not a criticism of you, Minister Donnelly. This is just to try and find out what exactly you know, don't know, and are being told about this, because you were asked earlier on, how was Leo Varadkar in 2019 able to say to the public that the hospital would be fully owned by the state? And you weren't able to answer that. You didn't know. And you were also asked if you can confirm if any terminations took place in the hospital, and you weren't able to answer that. Now, I want to differ with you on where you're getting your facts from, because the National Women's Council recently conducted a survey on the delivery of abortion services post-repeal, in the hope that very soon we'll be having a review of the legislation, which is meant to happen, I think, before the end of this year. And one of the things they were able to show quite clearly is that around half of the maternity hospitals in the country do not deliver abortion services at all since the legislation was passed. So if they can find that piece of information, it seems extraordinary that you cannot establish whether or not terminations as just one service of reproduction that's legally entitled, women are legally entitled to, and indeed men are legally entitled to vasectomies, whether or not they can be performed currently in St. Vincent's. I just find it extraordinary that the information you're giving us is not adequate. But I want to turn to the key question, which is the question of ownership. In your statement, you conveniently go back to the letter published in the Irish Times, where 42 senior clinicians expressed concern that misinformation and misunderstanding could delay what they describe as a vital project. And I accept your bona fide that we all have to have this and we have to have it sooner rather than later. But is it not the fact, and I think it was more or less admitted by a civil servant in the last meeting we had, that for the last 8 years, this project has been held up because, as you quote, the many legal entities that have been involved in discussing it. And is the core issue of that not the ownership of the land? If the state had owned the land, would this legal, torturous process, this complex method of how companies and charities deal with this issue, would this not have been an obstacle if the state owned the land? You've said to us, and you've said in the Dáil, that your preference is for the state to own the land. Well, I'm asking you now, will you call on the sisters to gift over that land to the state, publicly call on them? You have the high moral ground here. We've been pumping 300 million a year of taxpayers' money into St. Vincent's Healthcare Group. Why do you not publicly call on them to hand over the land to the people of Ireland?
Thanks very much, Deputy, for the questions. Can I just say on the issue of termination, the situation is, as we'll all appreciate, that terminations by and large will happen in the maternity units themselves. Now, I take your point. You were raising it by way of background, Deputy, around actually there is very uneven spread of that across the country, and it's one of the things we'll be looking at very closely in the review of the Act, and we'll be getting that review underway very quickly. I know that's for another day. I think the point I was probably trying to make, and apologies if I was making it badly earlier on, is that all procedures are permitted at St. Vincent's. They have confirmed that themselves. In the case of a termination, you may have a termination performed at St. Vincent's if a woman, for example, was severely ill. But in the normal course of events, those procedures would be provided at maternity hospitals. What I was saying was that the information provided under the legislation doesn't specify the locations, but I will endeavour to provide for the committee the information that has been requested. And then to the question you ask around the ownership of the land, it is my stated preference that the state would own the land, and I have raised this directly with the stakeholders. However, I just think it's important to say that regardless of whether the state owns the land, what we have to focus on to ensure clinical and operational independence, which I think we all want, is not who owns the land. It's the governance structures and the independence through the hospital itself, right? And that really is the focus. I think the ownership of the land matters to people, which is why I said that it is my preference, and indeed the government's preference, that the people would own the land. But I do believe that it's not the solution to clinical and operational independence. That's around governance, board members, reserved powers and things like that.
But surely if the state owned the land and the hospital in its entirety, then as this tarnished the state would have more influence on the governance on the board of directors, because it would be entirely in the ownership of the state. And it is the question of the ownership of the land that has held up the reality of this hospital for years. So it is a huge issue, but I just want to return to why it's a huge issue, and it's because we don't trust the church. And I think that is a fair enough statement to make, given the legacy that we've had in this country, and statements made by the Sister of Charity head herself, who said that the hospital will maintain the ethos of Mother Mary Aikenhead. Sister Patricia Lenihan said this last year. Now, you have to square that circle for the women of Ireland, because it is a very, very important issue, given the legacy of this state in its treatment of women. And it can't be just sort of parked that because you are all paranoid. Well, another way of describing paranoia is a heightened sense of awareness. And there's a collective heightened sense of awareness here among the women of this country that we do not want the church having any say whatsoever in our maternity care. And there is a principle that flies in the face of Sláinte care, which Roisin and others worked really hard on, that we need to move to a fully state-owned and controlled healthcare service. If we're spending millions on this, why do we not pursue the ownership of it? Which is why I'm asking you to publicly call on the sisters to hand over ownership of the land. I understand legal niceties, but they've gone on too long.
Thanks very much, Deputy. And can I say that I agree with an awful lot of what you just said. And let me be really clear. There is no one is dismissing the concerns being raised around clinical and operational independence. I understand that. You understand that. All of us on the committee understand that. And we're taking it very, very seriously. And to the second point you raised around, you know, a Catholic organisation, a religious organisation, these issues were raised. They were raised on committee. They've been raised in the media. And so on the back of those, I went and took another look. And I asked the department to take another look to be absolutely sure that there would be no influence, be it Catholic or any other influence, other than a secular influence in the laws of the land and governed by good clinical practice. And I won't be bringing any recommendation to the Oireachtas, to government, unless that is absolutely guaranteed. We went back and looked at the charter, for example, of St. Vincent's Healthcare, because it had been alleged that this was that this was carrying on through its charter and through its mission, specific reference to Catholic ethos. And I'm glad to say, Deputy, that is not the case. The ethos that they reference, there are a few. The core values that they reference are human dignity, compassion, justice, quality, and advocacy. And they talk about their mission being to advance medical education, promote medical research, patient care in all areas of medicine, to be known for the highest standards of patient care, clinical excellence, medical research, staff education, and so forth, and things that I think we would all say that they all sound very, very, very reasonable. But I can assure you, Deputy, all such concerns are taken very seriously, and everything is being done to ensure, to make it absolutely watertight, that this
one final question for you, Minister,
and secular.
If I may ask one final question then, and it kind of gets to the core of this. If you believe all that, and if you're reassured by what you're hearing, being told, or what the sisters have written down, and that all services will be available and there'll be no influence of any religious ethos on the delivery of services in this hospital, then why do the sisters not give up the land? There has to be an answer to that question. And I believe the answer to that question is their corporate interests. The Catholic Church are the biggest owners of land in this country. They very seldom yield it over for state interests. But I believe that that's the reason why. Why do you think that the church will not relinquish the land to the state?
So the Sisters of Charity are transferring the land to St. Vincent's Healthcare Group.
I said to the state. I understand that, but why would they not give it to the state?
Look, that's the position that they've taken. It's the position they took a long time ago. It's the framework that was agreed under the Mulvey Agreement and all of the subsequent work that can be done. It's not for me to speculate as to why transfers are made, but what I can say is they stepped back from St. Vincent's Healthcare Group. I think it was in 2017, Deputy. They are fully transferring all ownership to the healthcare group, and that healthcare group does not contain any reference to the Catholic Church or to the Vatican or to anything like that. And I think as another safeguard, I think it's important we go back to the National Maternity Hospital in Holles Street. I think they do a very good job. I think they provide, well, we all know they provide the full range of services. And I don't think any of us have ever suggested that the clinical leads in the National Maternity Hospital would allow themselves be constrained by, let's say, a religious ethos. And let's remember that the National Maternity Hospital themselves have looked at the governance arrangements and said, this gives them the clinical independence that they need. I think we as the Oireachtas are adding an extra element to that, which is the public interest. But certainly it would be very hard to see. Sorry, I don't mean to speak for you, Deputy, obviously, or anyone on the committee, but I think we probably all would have a very high regard for the National Maternity Hospital at Holles Street. There's no way that they'd be signing up to an agreement whereby they were being told what they could and could not do based on any religious ethos. And what we all need to make sure is that that is enshrined in the legal protections and powers of the maternity hospital when it moves to Elm Park.
And can you guarantee that we will have, as a state funding this project, the majority influence on the board of directors?
Not at this point. I can't. I would very much like to be able to say that. Those conversations are ongoing.
And if you can't, will you then
Minister, Brid, I need to move on to this others.